Hello everybody, my name is Hassan Nafid. I am an anatomy and physiology instructor at Madison College in Wisconsin. We will continue in our anatomy and physiology sessions. This time we are going to talk about one of the bones of the axial skeletons. Actually, it's a group of bones that are put together. We're going to talk about the vertebral column, or what is known as the spine. The spine is a group of vertebrae that is put together, and it extends from the skull to the pelvis. This is a model of the vertebral column I would like to share with you. And as you see, our vertebral column extends from the top of the body, where you can imagine the skull here. It's a fetal skull, but still we can imagine that. So from the skull to the pelvis, it forms the body major axis of support, and it surrounds and protects the spinal cord. The vertebral column consists of 24 single bones, and these bones are known as the vertebrae. One is vertebra, and the plural form is vertebrae. And also there is two bones at the end of the vertebral column, and these two bones are fused vertebrae, and these are the sacrum and the coccyx. And these are connected in such a way that they provide a flexible, curved structure. If you see it from inside here, it's curved and flexible structure. Of the 24 single vertebrae, the 7 bones of the neck are known as the cervical vertebrae. So the 7 of the neck are known as cervical vertebrae, and the next 12 are the thoracic vertebra, and the lumbar, which is the back vertebrae, are 5, and they are known as the lumbar. Easy way to remember these is breakfast at 7, lunch at 12, and dinner at 5. The individual vertebrae, as you see, are separated by a disc-like structure. We call it the intervertebral disc. As you see, from the top to the bottom, these vertebrae are separated by this cartilaginous, rubbery, flexible disc, which we call the intervertebral disc. It provides support, it is a shock absorber, and it prevents friction between the vertebral bodies. With age, this intervertebral disc tends to get thinner, and sometimes they are eaten away or get really thinner. It's no longer doing the job, and that's what results in some abnormal shapes or conditions of the vertebral column. Some of it causes the vertebral column to bend that way, and that's what we call scoliosis, or sometimes it bends forward, and this is what we call kyphosis, or sometimes it is a combination of the two, which is kyphoscoliosis, this way. And this is typically with old age or deficiency of calcium, or any condition known as osteoporosis, in which the bones are so thin they're no longer to hold the weight of the body and any other, which results in deformity. As you observe in between these vertebrae emerge the spinal nerves. There is about 31 spinal nerves that emerge in between the two vertebrae through the intervertebral foramina. Intervertebral foramina is formed by the space between the two vertebrae. I'm passing the probe in between right now, so you know, or you see where it is located. These is formed by the articulation of each vertebra, the top and the lower. There is a space between the spines and the body of the two, which form the intervertebral foramina. Each vertebrae is an anatomical structure that is formed of a body. I'll share with you. And this is the body of the vertebra. And see it from here at the top. And the spinous process to the back, which is then the posterior back. If you take a look at this one here, that's exactly how it looks like. This is our back, and this is the front of the body. So this is the anterior side, and this is the posterior side. Again, here is the vertebra. So this is the spinous process. This is the body. And this is our transverse processes. The two of these are the transverse processes. So transverse, spinous, and the body of the vertebra. This is known, this foramina, which transmits the spinal cord, is known as the vertebral foramina, and through which the spinal cord passes from the brain to the lower end of it as the coda equina or coda equina, right here at the end. Enter, or the vertebral foramina. This piece is known as the pedicle. This is known as the pedicle of the spine. This is the pedicle, right between the body and between the transverse process. So this is the body. This is the transverse process. That part of the vertebrae between the two is known as the pedicle. And that part between the transverse process and the spinous process is known as the lamina. So we have the lamina, the pedicle, the two transverse processes, the spinous process, the vertebral body, and the vertebral foramina. These are the parts of the vertebra. Most vertebra share the same structure with minor differences in the size of the vertebral body and the length of the spinous process. If I showed you the spinal column here, or the vertebral column, you are going to observe that the size of the vertebral body gets larger or bigger as we go down, and the spines or the spinous process gets shorter. You see here, it's a little longer, and that's what you could feel in the back of your neck, like the spinous processes are felt in the back of the neck with a finger. You can palpate it with the finger, but they assume this shape as we go down the thorax or the chest, and they get shorter as we go down towards the back. These are some examples here of vertebra. Notice the difference between the size of the body. This is the size of the body of cervical vertebrae, how thin it is compared to the body of the lumbar or lower thoracic vertebra. As I mentioned before, the first and second cervical vertebrae are known as the axis and the atlas, and they articulate with the skull, and they help our skull to move side to side, like saying no, or nodding the head saying yes, and they articulate with the processes of the occipital bone here to help us. Another part of the vertebra that I want to show you, and this is the articular surfaces of the vertebra, and these are known as the superior articular processes or facets, and the inferior. So it's two of them. Each vertebra articulate with the other one through these facets, like superior on the top and inferior on the bottom. Also, it is important to say that vertebrae articulate with the body of the ribs in the back and in the thoracic cage, and this is what forms the two articulations of the ribs. Thank you for watching this video, and I'll see you next time in one of the videos.